androgens. If a woman just has excess, then maybe that's why PCOS happens. It can also be associated with excess amounts of insulin because the body will tend to release more androgens to fight the chronic high blood sugar hyperglycemia that happens with increased insulin. And PCOS actually, it goes hand in hand. Well, doesn't go hand in hand, but it can look like diabetes. It can seem like you have diabetes. You can even get diabetes from uncontrolled PCOS. And a newer hypothesis is about a low-grade inflammation. So actually having polycystic ovaries can trigger the body to have a low-grade inflammation that works on the polycystic ovaries to release excess androgen. There's no real mechanism behind why that happens, but some studies seem to think that that's the mechanism that causes all of these symptoms. So there's a lot of symptoms of PCOS because with hormones, everybody reacts differently. Someone can have a more mild case of PCOS and only have irregular menstruation. They can have some more minor things. If you have really extreme PCOS, as I'll show you some examples, you can have a lot more severe symptoms that make it very obvious that you have it. But it does affect you externally and internally. So some internal symptoms are irregular periods, and that's like 3 categories of irregularity. There can be girls with PCOS can have less than 9 periods a year. Girls with PCOS can have more than 35 days between cycles, and you can have prolonged menstrual periods. So instead of going a normal 4 to 5 days, it can go on for weeks. Polycystic ovaries, obviously it's in the name, so this is a little diagram of a normal ovary and how the vesicle and the egg develops, and polycystic ovaries where the vesicle is filled with fluid and stayed within the ovary instead of releasing in ovulation, which is what's supposed to happen. There's also associated severe anxiety and depression, and the mechanism of this could be from the excess androgen, but it also is associated a little bit with girls who present really severe external symptoms because they do develop as a female and then also have some really stark male secondary characteristics. And it's the excess androgens, mostly testosterone, that cause the many external symptoms. And there's some big hallmarks, so I'm going to take you through all of them right now. So the first one is acne. One of the main mechanisms for why people develop acne is testosterone. That's why you see it a lot more with boys in puberty. So girls with polycystic ovaries tend to have more severe acne and grow it in places like along their jawline, their arms, and their back. And that's where boys tend to typically get acne with their onset of puberty. So girls with PCOS kind of present the same. The next one is in very severe cases, girls get male pattern baldness. So the mechanism on this is a little bit more unclear, but you can see on this girl, she has a receding hairline. So her hair is moving backwards. And then this girl on the right, she's starting to form the halo. So you know on cartoons, or like really old guys have like the middle of their head bald. That's happening to this woman at a younger age because of her increased androgen level. So you see like this cleft of hair growing and spreading, so it'll grow and spread until she also has the halo. The next one is rapid weight gain, and this can happen in 2 different ways. So there is weight gain associated with female puberty, but PCOS is different because it happens very irregularly and fluctuates depending on where the girl is in the cycle. So some girls can gain 2 pounds, some girls can gain up to 20 pounds. It's like very different depending on the severity of your imbalance, but there's 2 different ways of rapid weight gain. So this woman on the left, you can see that her back is arching and it's seeming like she's being pulled forward. That's because this rapid weight gain is associated with bloating around the menstrual cycle. So girls can bloat and gain weight and almost look like they're pregnant. The girl on the right is more of fat packing or fat accumulation that's associated with PCOS. And the last one is probably the one that if you guys have ever seen headlines, I know that it was on Snapchat, like the Daily Mail stories about girls who grow excess body hair. This is called hyracy, and it's male pattern excess hair growth. So this girl on the right obviously has a very well barbered hair, like beard, nice little goatee mustache combo going on. And this girl, you can't see it as well, but she has male pattern hair growth all over her body. So she has a beard, she has a mustache, she has chest hair, and then I couldn't fit it on, but there's a picture of her from the back. Her back is covered in hair. So that's also a result of having PCOS, and this is actually one of the things doctors look for. And this again can also be on a spectrum. So girls can maybe grow more hair on their upper lip. That's a sign of some sort of a degree of PCOS. Girls might only grow like peach fuzz. It just depends on how big your hormone imbalance is. So because there's so much that it could be, the mechanisms are unclear, that kind of thing, diagnosing PCOS can actually be pretty tricky. And diagnosis can actually be missed because it can be mistaken for a lot of other things. So you can be treated for a lot of other diseases before finding out that you have PCOS. So there's a few steps that you have to go through for diagnosis. First is a discussion of your family history. So when you sit down with the healthcare provider, they'll ask about whether your mom has PCOS, whether there's history of things like endometriosis, fibroids in your family history. So that could be a link to maybe whether or not you have it. The provider will also conduct a bimanual pelvic exam, which is pictured right there. We also learned about this just so that the provider can actually feel for any abnormalities, so cysts, benign tumors, that kind of thing. Blood tests will be done, obviously to check your hormone levels. So hormones travel through the blood, so we check the blood to see if your hormone levels are normal. And then they also want to look at fasting glucose and triglyceride levels because PCOS does have a link with insulin insensitivity. So that's something also doctors need to look at. If you have this insensitivity, if you have chronically high blood sugar, because that can be maybe a sign of diabetes, maybe a sign of PCOS if you don't show the other signs of diabetes mellitus. And finally, an ultrasound can be done to look at the actual ovaries themselves. So the biggest hallmark that a provider can use is looking at your ovaries and seeing if they give the lumpy appearance of having the fluid-filled vesicles. So again, since this is so complicated, there's no treatment or cure for polycystic ovary syndrome. Basically, treatment is managing symptoms, and treatment plans are going to be based on the individual patient's needs. So if I have PCOS and I present different symptoms as you have, then maybe we need different treatment plans to fix the symptoms that bother us the most, because they may not be the same. So the number one thing that providers tend to prescribe or recommend is lifestyle changes, and it's recommended for all types of PCOS. Losing as much or as little as 5% of your entire body weight can greatly reduce your symptoms, make you feel better, and that also has to do with the link that maybe rapid weight gain causes PCOS, maybe metabolic disease, it copies metabolic disease, so maybe that would help. And then if that's not enough, so some girls will do the lifestyle changes, eat right, exercise, they'll feel a lot better and not want to continue with any sort of management. But if your PCOS is so severe, if you're growing a beard, obviously diet and exercise is not going to get rid of that. So there are pharmaceutical options, and the main one is combination birth control pills. So there's different types of birth controls, but the combination uses both progestin and estrogen, and that helps to decrease the amount of testosterone, and estrogen also is part of the imbalance. There's more estrogen than required, so that also helps to balance everything out. And there's also progestin therapy, but it's not really recommended, so let's not talk about it. And finally, uncontrolled PCOS can have a lot of implications on the rest of your body. So not only do you have irregular periods or things like heresy or acne, but the increased insulin or the increased blood glucose and insulin insensitivity can do things like lead to cardiovascular disease, hardened vessels, things like that. But all these complications, some can be treated, some can't. The ones that are normal and manageable are things like infertility. Infertility comes from the way that PCOS throws off ovulation. So if we can fix throwing off ovulation and make it more regular, then infertility will not be as big of an issue. depression, anxiety, sleeping disorders, when we balance out the hormones with birth control, that can be helped. If we can help some of the external symptoms, maybe depression or anxiety coming from self-confidence will also be fixed. Abnormal menstruation, as we know, is fixed by birth control, and gestational diabetes because we are managing our weight. But there are more long-term and serious ones, so there's miscarriage and premature birth that has to do with the variable endometrial lining, that has to do with your personal hormone imbalance. Metabolic disease, so like I said, it mimics diabetes plus causes you to have a rapid onset of weight, so that can cause actual real life diabetes. Obviously not good if left uncontrolled. It can cause a thing called non-alcoholic steatohepatitis, which is inflammation of the liver due to the accumulation of fat. So again, this has to do with the rapid weight gain. If the body gains fat so fast it can't distribute normally and loads the liver, then it can impair function, which we know the liver is very important. And finally, it can increase your risk of endometrial cancer, and that has to do with the out of control estrogen levels.